I'm Bill Shapiro. I am the supervising audiologist at the Cochlear Implant Center at NYU Medical Center. What I'm going to talk to you today about is something called Beyond One Ear. And what that means to me is when a patient comes in to be evaluated and to be counseled, they should be leaving either with an implant in both ears or an implant in one ear and a hearing aid in the other. And I think because the criteria for selection has changed and we're expanding so much, I think device counseling is now critical, because when a patient comes in, we may be talking about a cochlear implant on one side, a hearing aid on the other. There was a 52-year-old patient who had a right ear who had a moderate to severe loss and a left ear with a severe to profound loss. And the patient got some benefit from their right hearing aid, but got no benefit from their left. They were implanted with a cochlear implant on their left side, and they went from 0% to 62% understanding. They even had a bimodal bump when you turn the hearing aid on at their 3-month evaluation. And at 1 year, they even showed a continued improvement and a real good bimodal bump when they wore the hearing aid in the cochlear implant. This was a patient that had a nucleus 512 internal, so they wore a resound hearing aid on the contralateral side, so they had some synergy there, and they were able to stream bimodally. And that patient was doing well until about 2 months ago. My understanding is her better ear is starting to get a little bit poorer, so she's going to be coming in for an evaluation, a sequential evaluation. I suspect that she'll need a cochlear implant in her better ear now. So she went from having one hearing aid to having an implant in a hearing aid, and now she's going to be going to be a bilateral. And I think that's a reasonable sequela for some of our patients, because now they've been stimulated throughout the whole way. So one of my concerns is, as I talked about before, there are audiologists out there that feel that if a patient has one better ear, they're not a candidate for a cochlear implant. And again, I would encourage those audiologists to refer these patients to cochlear implant centers. You can over-refer. If you think someone may be a candidate for an implant, reach out. Times are changing. The technology is getting better. The criteria for who's appropriate for an implant is expanding.